Ryan Osborne here with Denver 7. We're talking with Dr. Jason Glass, Superintendent of Jeffco Public Schools, talking about the restart plan. It's such a unique situation, Dr. Glass, amid the coronavirus and taking social distancing precautions. And Jeffco announced that you're going to start classes remotely for 2 weeks, then transition into both in-person and a hybrid model. But Dr. Glass, what has been the biggest challenge for you this summer, and you and your staff and the whole district trying to figure out what you're going to do in this great unknown?
I think we really have two competing priorities, both of which are really important. One of those is the push to get schools open in some fashion. And the push for that comes from academic concerns, social, emotional, and mental health concerns for our students. So we also have concerns around the economy and the workforce support for our families. So those are all compelling reasons to try and get school open, especially get some in-person option open in some way. And then we've got competing against that health concerns that our staff are rightfully concerned about their own health, and we want to make sure that we keep our students and our staff safe, and we don't allow the schools to become a vector by which the virus spreads in our communities. So those are the two pressures that we're working to find some middle ground or solution for. We want to get schools open, but we also want to make sure that we do it taking every prudent and safety step we can. Well, I would say that we're working toward that in-person option. That is our goal, and that's what's in our plan right now. We're taking really that first 2-week period to do remote learning, but it's also to do orientations with our kids and our staff to make sure that they understand the virus mitigation strategies that we'll be using. This should not be seen as that we're conceding that we can't open school in person. It really is a thoughtful process to make sure that we do that right. The ultimate goal is to get schools open, create that in-person experience, but we want to make sure that it happens safely. That will involve symptom screening and temperature checks when students and adults come into the building. It'll involve requirements around mask wearing and social distancing to the greatest extent we possibly can while in the building. There'll be changes to our ventilation systems. There'll be changes to the way students move through the buildings, requirements around hand washing, increased cleaning protocols. So there are these layers of different virus mitigation strategies that you use in addition to cohorting groups of students together. So you have smaller groups, and then at the secondary level, we're actually reducing the number of students that are in the building at any time at our middle schools and high schools so that we can achieve that social distancing element at that level. Right now we have virus mitigation strategies that we're using with our athletics and activities as well. So they're doing temperature screening, they're doing social distancing to the extent possible. Where they can't do social distancing, they have protective equipment, including face coverings. And we're proceeding right now trying to restore as many of those services and activities and sports as we possibly can. I think as we look into the fall and what that may be like, it's really anyone's guess, and no one can speak with any certainty about what's going to happen with athletics and activities because we have to look at the conditions as they come. But I think we really have to look at the conditions in our community and pay attention to those. We have seen other international systems be successful at reopening schools and not creating a vector for the virus through doing that. But those are also countries that have done a really good job of suppressing community transmission. It's really going to be everybody's responsibility. If you want to help us get schools open, everybody's got to do their part in not allowing themselves to be a vector for the virus. We do have a matrix where we'll look at the conditions in Jefferson County and in the Front Range and move between all remote as we were this spring when we were in the stay-at-home orders to where we are now, which is sort of a cohorting and hybrid approach with layers of virus mitigation strategies. At the elementary level, we have research from several large-scale studies now that tells us that the transmission of the virus, infection rates for children younger than 10, and the adverse effects for children younger than 10 is dramatically lower than it is for other age ranges. So at the elementary level, that's why we're putting forth this 100% in-person option for families, along with a remote option if the family wants that for whatever reason. But the cohorting will be used there. So in that case, you have a group of students that's in one class. They don't mix with other students. So that what that creates is, if you have someone that passes through and gets through all of our other virus mitigation strategies, it's contained to that one class and it doesn't spread, cause an outbreak in the whole school. At the secondary level, we again, from that research, know that kids over 10 roughly tend to have infection rates and be able to spread the virus just like adults do. So we have to be more careful there, which is why we're creating that hybrid option at the secondary level, where we'll effectively be able to cut the number of students that are in our classrooms dramatically down. That'll allow us to do the social distancing, spread people out. And so we have looked at the data, looked at the science, looked at public health guidance, and tried to put forth an in-person plan that's responsive to the latest scientific information available. No school leader, no school district is able to find a perfect plan that solves all of our problems that everybody is going to agree with. So we're all in this place of trying to balance that, the concerns around students, the concerns around families, and the concerns around our staff, and trying to contain this virus. As communities come forward with plans and we keep working on these, we also have to be flexible and understand that conditions can continue to change. So things may have to adapt, and we're going to need our communities, our parents, to support our schools as we navigate through this.